next up, we will figure out and find out about what opportunities are available as an undergraduate to get your feet wet, gain some experience and find out what it's like. So please give a warm welcome to Kiera Butler of the Alliance for Suicide Prevention of Larimer County and Janaque McDonough of DaVita. So thank you very much for the presentation.
Hi, everyone. Thank you for having us. I'm not sure if I haven't seen Janaque on screen yet, but I'm sure she's there. But thank you for the introduction. Yes, my name is Kiera Butler. I use pronouns she, her, and I work for a small nonprofit in Northern Colorado called the Alliance for Suicide Prevention of Larimer County. But I did receive my undergraduate from Colorado State University in clinical and counseling psychology. If Janaque, oh, there you are, I see you now. Please introduce yourself as well.
Well, hi, I'm Janaque. I am the administrator for DaVita facility. I work in Charleston, South Carolina. I am a graduate of the University of Northern Colorado. I graduated with my undergrad in human rehabilitative services, and my master's degree I got through Colorado State University through their global program, and it's in organizational leadership.
Awesome. We do have a slideshow there. Thank you, Nikki. You are the best. Yeah, so just gaining experience in undergrad, we really would like to make this more of a conversation, and the slides are more to help keep me on track specifically because I love to talk and I go down rabbit holes. So slides are less important and more of a conversation. So please do ask questions, and I hope that we will be able to see all of them. So first, I wanted to just touch on taking advantage of opportunities. This was vital for my experience. I know that CSU had tabling events, career fairs, and I went into my undergrad having no idea what I wanted to do with my life. So I went to all of the events to explore what I wanted and kind of what drew me. And then at those tabling events, I found a ton of clubs and sports that I really loved and enjoyed, and that started my path of passion. Janaque, do you have stuff for taking advantage of opportunities?
So I have to be really honest with you. I was a non-traditional student in my undergrad, mainly because I was married. So I was married just after my freshman year. And so I didn't have as much time, to be honest, to be that involved in terms of career fairs and tabling events. But what I did get is I took advantage of the times when I was able to find people in my classes that had kind of gone to some of those events and recommended that maybe I check into some of those things. And so I think if you are a non-traditional student, it's a little bit more difficult. It's harder to be as involved and engaged in those things, but stay connected with your classmates to find out what things they've done or what things they've heard about that might be of interest to you.
I love that. That kind of leads into our next slide, which is to connect. So I think this is the one where we can both talk a lot about, but I really did find that same experience of talking to a lot of people around me. I realized that especially the later into my undergrad degree that I got, the more people that I was familiar with. So the class sizes became smaller and I knew more people. And so I really got to know my classmates and professors and found people that had similar interests as me. I remember my freshman year at CSU, and there was a graduate teaching assistant that walked into my Psych 101 class, and she was so cute and like she looked really pretty, and I was like, wow, I love her outfit, I want to be friends with her. And I got her contact information as a GTA, and she actually ended up being one of the people that supervised my research hours. I became an undergrad TA for her. So just because I liked her outfit led to that strong connection. And she was one of the people that wrote my letters of recommendations for grad school. So yeah, I'm sure you have more to talk about on connection as well.
I really find that making sure that you find those connections with professors that have taught you something that really resounded with you, because so many of my professors, and Kiera and I talked a little bit about this, I am far removed from my undergrad. It's been a long time, but I remember that a lot of my professors had world life experience that I hadn't had yet, or they had worked in the field in areas that I didn't even know existed as I was going through my undergrad. And so listening to, as they're teaching, kind of the things that they had experienced and how they'd gotten some of those experiences, connecting with those professors, I think, is really important. I know that for me specifically, I wasn't even considering human rehabilitative services as an undergraduate option. I was in nursing school, and I had a professor that was over the HRS department, and he loved the class. I was so excited about the class, and he actually was the one who said, are you doing the right thing? Is this really what you want to do? Do you really want to be a nurse? And I was like, no, I don't. I don't want to be a nurse. And so then he kind of helped direct my transition out of the nursing program and into HRS, and helped for me to identify whether or not that was going to be a passion for me. So listen to your professors, listen to that experience, and then when you find ones that you connect with, align with them and let them know that you are looking for their support.
Yeah, I love that. And I think too, I remember, so I'm only a year and a half out from undergrad, and I remember so often people were like, make friends with your professors and like talk to people. And there were just days or times where I was like, this is so intimidating. And so I really do agree with Janaque on finding the professors that resonate with you. Or I remember there was one professor that just seemed so kind and open-hearted, and I would go into their office hours all the time, and he was the one that helped me find my internship, which was actually at the nonprofit that I'm at. So just really building those connections with the people around you and being yourself, I think that will allow you to make those connections and finding people that are similar to you by being yourself. So not fitting into any mold that you think, and Janaque is in this amazing field ahead of her, and we could look at that of I want to be just like her, but you want to be yourself in that space, in that field. So creating your own path, and I really do think that will come along with those connections and just being yourself and finding the people and professors that are similar to you in some way. And I think that kind of goes with the next slide. I believe it's internships. Yes. So I was really, really fortunate that Colorado State has, especially in the clinical and counseling psych degree, has an internship page. And I put my internship off until the last minute, until my last semester. Internships and research are not my jam, so I was really intimidated by doing those things. So I was fortunate that there was a list that I could refer to for internships. But I actually was really, really lucky. The day that I was going to go talk to the professor that was running all of the internships, I ran into a friend who was walking along the sidewalk, and she was like, hey, you should come meet my current supervisor for my internship, because she was about to transition out of that position. I met her supervisor, and it turns out it was at this nonprofit, and they were doing work that I was extremely passionate about and drawn to. And I'm a big believer in manifestations and just you have that dream and really focusing on that dream and believing that the universe will provide that for you. And it really did. So my internship really fell into my lap, so to speak. So I ended up taking that internship with that supervisor, and it really was so after that internship, they actually hired me full time once I graduated. And so my current boss says that I'm a unicorn in the sense that we really just connected. And I think I really manifested that internship and this position at my current job. So I got a lot more fortunate when it came to internships. I'm not sure how you feel about that, Janaque.
I think that I actually don't remember whether or not there was a tab or a list for us to choose from. I do remember having a conversation though with my professor, with the head of my HRS program, and he had probably the best advice for people, especially that are looking at jobs in behavioral health. And he said, focus your internship in an area that is at the bottom of what you think of when you think of behavioral health. And so we talked through that, and I'm like, what do you mean the bottom? And he's like, well, I want you to think about when you are going to see your patients at their worst. When is that going to be? And so I was like, inpatient psych and detox. And so he said, okay, then I want for you to, and my program had an internship and a practicum. And so I did my internship in detox, and he was just so wise. He said, if you love it at this level, then you will love every other aspect of it from there on up. He's like, the whole kind of looking at all of the different levels of what we provide in behavioral health. He's like, if you love it at this level, then you will know for certain that you'll love it beyond there. And so did my internship in detox and did my practicum it was in the same facility, but with their adolescent program as a counselor, and was hired by both of them, actually. I took a part-time job and a temporary job because all of the other counselors were having babies at the same time. So I was careful to not drink the water while I was there. But did my internship, my practicum, and then was hired on for their youth and family services program. And then hired on to work their other hours in detox. And I did that until I transitioned into inpatient psych. So interestingly enough, not only did I find my passion kind of at that level of care, I've worked the majority of my career in that level of care. I've seen outpatient. I think it's great. It's not my jam. So I thought it was just such good feedback. I mean, if I had started in an outpatient, kind of the beautiful, glamorous side of behavioral health, and then ended up working in inpatient, I might not have enjoyed it as much.
I really love that. I so agree. Yeah, I also did not see myself in the nonprofit field, and it definitely just worked out for me. I do see there's a question for you, Janaque.
I can kind of see it. Let me take a look here. In the chat. I'm going to nursing. I like what I'm not in the program yet. I'm accepted. Okay, my suggestion would be find someone and see if and the COVID is hard. This is not going to be easy because COVID's made it very difficult, but you need to kind of figure out that same level. How I figured out that I was not meant to be a nurse, I got a job as a CNA, and I worked as a CNA, and that was how I figured out that was not going to be my career path. And so I'm because I'm non-traditional, I think I had a little bit of a different path in terms of going to school and working, being married, but I've given the same feedback to my own kids now, which is if you're passionate about it, get your foot in the door with a job, if you can, while you're going to school, to find out, is this really what you want to do before you invest, 5, 7, you want to be a psychiatrist, 15 years in to a program that you realize later this is not what you wanted to do. So I guess the first thing I would say is, if you're not able to do shadowing, which is really difficult, especially with COVID right now, I would highly suggest getting into a job as a CNA and seeing if it's really what you want to do.
Yeah,
You're welcome.
I'm not far out from my undergrad, and I'm not far into my career field, but I would say I definitely agree of just trying to get your foot in that door. And for me, it was talking to a lot of people that were already in the field. So gaining their insights of what is a day in your life? What does that look like? And how do you feel about this? So I'm going for clinical mental health counseling in my graduate degree. And I just talked to all of the professors I knew that were still practicing therapy or used to do therapy and were no longer doing it, and why that was. So having those conversations. Yeah.
Absolutely.
And then our next slide here is on volunteering. I did want to touch on that briefly. I didn't do too much volunteering when I was in my undergrad, but I did do some, and I just did it where I was passionate. So I love feeding people. That's part of my spirituality, is feeding. So I just found local places that I could feed people, which was the Fort Collins Rescue Mission, and I still volunteer with them. I also found a club that was volunteering in local elder homes, and I was able to volunteer with them. It was a club that played music for elder folks, and I loved that. It has nothing to do with my career, but I went and I just hung out with them. I cannot play music, but I just wanted to go. So my volunteering experience wasn't directly related to my passion or career, but I do think it's really important to get those volunteer hours and give back to your community, as it does help your own mental health, but also can help you find where you might be passionate in a certain area.
I think that's great. I trying to think about how much volunteering I did, mostly because my path was just a little bit different. I was really working alongside of going to school, and so not that I didn't have some aspects of volunteering. Really enjoyed, I don't even know if this is still a thing anymore, but got to spend some time at Foothills Gateway, which was pretty amazing to do some of that, some volunteering there. I suggest, another thing to be looking at in terms of volunteering is test the waters of all the different parts of behavioral health that there is for you, and figure out if there's a certain population that really becomes your why for getting up in the morning. And I found out for myself that there were certain populations that it just was not, it wasn't for me. And that's okay. That's an okay thing to find. It's an important thing to find out. So I suggest, if you are able to do it through volunteer work, do that.
Yeah, I love that you touched on. There is. Yeah, I love that you touched on populations, because I mean, when I volunteered with elder folks, I realized I love them, but that wasn't the population I wanted to work with. And now I work with youth specifically, but also general middle-aged adults. So yeah, I love the population point. But there's a question for you in there.
Okay, so what was it like working in patient detox? I really suggest that, and my belief is that anybody who is working in behavioral health, that you have got to make sure that you have really, really good skills in terms of what does your interpersonal effectiveness look like? Are you able to to be engaged and then do some of that detachment at the end of the day, because it's easy to carry it. And I had to learn that pretty quickly, that this was my work role, but this is my life, and that I needed to be able to separate the two things, because I mean, I went from inpatient detox to inpatient psych. And so I've worked the gambit. I've worked outpatient and inpatient, but primarily spent the majority of my career working inpatient. And it has to really be about, you know, when you are working for a place and you are confident in your skill set, where you can say, I know that every single day, every patient that walks through these doors is getting best practice care, every patient, every single time, then when I walk out these doors, I can leave it here. But if you are still shaky on that, then I think that it has the potential. I mean, this career path is a high burnout. Look it up. Look up exactly. I don't remember the exact numbers anymore, but I know that it's a significant burnout. So, you know, have that. You have to have your own awareness. I am hugely boundaried. I think that you need to have pretty strong boundaries when you work in behavioral health. Without those boundaries, it can make it really difficult, and you're too enmeshed. And you need to have that awareness and be willing to take feedback from people that can see that. Practicing and maintaining boundaries. It's a skill set. It's a skill set. You hopefully will be learning a lot about that in your undergrad program. If not, really be focused on every single thing that you say should have a why for why you're having that conversation with the patient. And if it has anything to do with your why, you need to let it go.
Yeah,
kind of my quick and dirty boundaries.
I so agree. I actually learned a lot on boundaries in my internship, just interning in the field that I'm in. So I actually lost my best friend to suicide, which created the passion for suicide prevention. And that's the field that I'm in. I work with youth, and I also do grief services here at the Alliance. And you really do have to have that separation and be able to stop working at 5 p.m. and know that you have done all you can for the day. For me, it's my signature in my email. It has the crisis line. And I know that if someone is in crisis and they email me after work hours, I've done all I can. So setting those boundaries and knowing, but setting yourself up for success. So knowing that you placed that boundary there, and that's the best that you can do, and you have to take that time for yourself. So being able to separate your trauma and be far enough out from it and have worked on it in order, if you are passionate about what occurred to you in that trauma, being able to work on it in that moment and not pull it into the work that you're doing with clients. We do have one more slide, but it's all just about being yourself, and we still have 6 minutes left for questions, which I'm excited about. So I do see one in here. What made me choose the master's program that I'm in? So that's a great question. I actually, from the graduate assistant that I was working under, had a book that had a quiz in it that was master's versus PhD. And if you want, you can totally email me and I will find out what that book was. And it allowed me to decide if I wanted to go master's or PhD route. I was super set on PhD in my undergrad, especially being in a Bachelor of Science degree. I was really on the PhD route, and I think it was Carolyn who was presenting earlier mentioned, if you're not a good test taker, that's me. So I really needed to find a program where I did not have to take the GRE. So that was like a #1 for me. I cannot take the GRE. But I also gave myself grace. So I took 1.5 years off from my undergrad before going to grad school. And I think that time off has really allowed me to grow and know that this is my passion. This is the field that I want to be in. And it just really set that in for me. So I just found a program that also aligned with my beliefs and goals. I studied abroad in my undergrad, which I highly recommend. And while I was abroad, that really deepened my spirituality. And I found a program that aligns with that, a whole school that aligns with that. It's called Naropa. It's in Boulder, Naropa University. I super recommend. But they have beliefs that align with me, as well as the way that they take tests and the things that they research there. So just finding programs that align with you and that speak to your heart. Yeah.
I had completely different paths, just in terms of grad school. When I finished my undergrad, was back in the dark ages when you could do lots of different things in behavioral health, a little bit broader before all the need for licenses, which I think is good. But so I had a lot of experience working in case management, running groups, lots of, like I said, lots of different modalities, lots of different levels of care, and realized I don't want to be a counselor at all. I really don't enjoy this. I enjoy skills. I enjoy teaching people how to have a life that's worth living. And so my career path took a different turn, and then realized that one of the things that I really love is about being able to make an impact within behavioral health at a different level, not just at what I was providing, but in terms of the organization, what the organization is providing. And so even though my current job is the first job I've had that's not in behavioral health, but having kind of had that long career path in behavioral health, and then finally deciding that, you know what, I really love is leadership, and healthcare leadership specifically. And so that all started from a behavioral health career, and a long behavioral health career that then became a behavioral health career in progressive leadership. And my last job prior to this job, I was the director of operations for a psychiatric hospital. So it can look differently if you decide I love the clinical piece and you want that patient engagement. I loved being with my patients, but I never wanted to do, what Kiera wants to do. And so there's lots of different avenues in behavioral health, and there's levels of behavioral health executive leadership that is needed from people that have the same passion that Kiera has, but with that business mindset, because no money, no mission. So you still have to have people like me that we're passionate about it, but we're also the operations piece of it.
Yeah, Janaque, I really love that you touched on multiple aspects of the passion, because there are so many directions that you can go. I think too, in our undergrad, it's easy to be jaded of this is the one path, this is the one destination, but you can have your passions and they can take you in so many different directions. So I'm going to put my email in the chat. I know we only have 1 minute left, but feel free to email me if you have any questions, as well as I will always plug the work that I do. If you need grief support for suicide loss, also email me, or any other support in Northern Colorado. I'd love to be there for you all.
And I'm happy to put mine in the chat too. If you have questions or want to reach out, I would be happy to support you. I'm not in Colorado anymore, but I lived there for a very, very, very long time and have only recently left. So happy to help.
Mm-hmm.
Well, thank you both. What great dynamic we had going on this session, which we have Kiera kind of starting out, just graduating, getting going, and then we had Janaque, who's been in the field for a while. So it's great to get both of your perspectives. And I would have to say, and I hate to admit this, it was 30 years ago, me coming out of grad school, and before that with my undergraduate, I wish I had had all of this kind of insight. So thank you so much for sharing.